Given it's nearly 22 years old, we do need to relook at the practice, the GP contract. There does need to be some streamlining. There's too many bolt-ons. It's become really complex. There's too many locally commissioned services that can end up being quite a mishmash. It feels quite inefficient that there's a mix of local and national commissioning, and there's too much of a postcode lottery for too many patients. There's too much variation from place to place. I don't think we necessarily need to rip up the GMS contract. I do think we need to go back to first principles. We need to be clear about what general practice should and can deliver, and we need to see what agreements we can come to. But we definitely need some contract reform that simplifies things and makes things clearer for local systems about what GPs can and can't deliver. The fact the contract isn't overly specific is positive in some ways, because when a patient comes to see us, the last thing we want to do is say, no, we can't do that because of our contract. That doesn't work for anybody. It doesn't work for GPs and it doesn't work for our patients. But actually that is the situation we're finding ourselves in far too often. That doesn't really work for patients if the funding doesn't follow it. We've seen huge amounts of left shift of workload without the funding following that, and we really need to be clear that, you know, where we've had that workload shift, and that's why we're asking for £40 to £50 per patient, because we've already had so much of that shift. GPs up and down the country are struggling with whether they should or shouldn't be doing work, and we need that to be clarified, and we need that funding to allow us to do some of that work where it's appropriate.